finished checking the physical properties of urine in the first PowerPoint presentation. In this one we will do chemical and microscopic examination. We'll start with chemical properties. You have to remember the 5 chemical properties: protein, microalbuminuria, glucose, bile and ketone bodies. In your book microalbuminuria is not given, so please note it down. We'll start the first chemical test for proteinuria. Before we do proteinuria, let's remember in a normal urine there is protein excretion of less than 150 milligram per 24 hour. It is so less that it is not detected by any small test. Then what is the definition of proteinuria? Proteinuria is defined as urinary protein excretion of equal to or more than 300 milligram per 24 hour. Proteinuria is also called overt albuminuria or macroalbuminuria. The chemical test for detecting proteinuria is called heat coagulation test. There is no need for you to know the procedure of the test. Just remember the result. If you see turbidity as shown in the top part of this picture, this means there is proteinuria. If there is no turbidity, there is no proteinuria. If there is turbidity, there is proteinuria. And what are the causes of proteinuria? Glomerulonephritis, systemic diseases like systemic lupus erythematosus, amyloidosis, sarcoidosis, diabetic nephropathy and multiple myeloma. The next chemical property is microalbuminuria. It is not given here in your notes, so please write it down. In a normal urine there is albumin and it is very small amount. It is less than 30 milligram in 24 hours. Microalbuminuria is defined as albumin excretion ranging from 30 to 300 milligram in 24 hour urine collection. Microalbuminuria is accurately measured in the lab by ELISA or radioimmunoassay or high performance liquid chromatography. You will hear in pathology and internal medicine that microalbuminuria is a very important test for renal screening. So what is this microalbuminuria? It is a very important risk factor. It is a marker of endothelial dysfunction and it shows the increased risk of cardiovascular morbidity and mortality. Microalbuminuria has a prognostic value or a predictive value. If someone has microalbuminuria positive, it means he will develop in future renal disease. If we want to follow up patients who are at risk of developing renal disease like diabetics and hypertensive, if they have proteinuria positive, it means they already have renal disease. But if proteinuria is negative, we will say he does not have renal disease. Okay, but what about the risk of developing renal disease in future? Microalbuminuria answers the question of risk of developing it in future. If someone has microalbuminuria positive, he will in future develop renal disease. So early identification of microalbuminuria and then early intervention with some medicines and proper blood sugar and blood pressure can delay the development of renal disease. The next chemical test is for glucose and reducing sugars. Normal urine does not contain any glucose because all of glucose is reabsorbed in the proximal tubule of nephron. What is the test for glucose or reducing sugar? It is Benedict's test. You do not need to know the procedure, just remember the result. If you see red precipitate like the picture on the right side, it means the urine contains reducing sugar. If you do not see any red precipitate, it means the urine does not contain any reducing sugar. Now if it's positive, what does it mean? It contains reducing sugar. Which reducing sugar can occur in urine? If we are checking some pediatric cases or newborns with metabolic inborn errors of metabolism, the reducing sugar can be fructose or uh, galactose in the urine in inborn error of metabolism. But the commonest cause of positive Benedict test is glucose in urine. What is the causes of glucose in urine? All causes of hyperglycemia, that is, for example, diabetes, Cushing syndrome, hyperthyroidism. So whenever there is hyperglycemia, there is glucosuria. What is the other cause of glucosuria? Renal tubular dysfunction. In renal tubular dysfunction, the disease is in the nephron, so the nephron is not able to fully reabsorb the glucose, and in these patients there is no hyperglycemia. His blood glucose is normal but urine is positive, so we suspect renal disease. But if there is hyperglycemia and there is glucosuria, then of course we suspect diabetes, Cushing or hyperthyroidism. The next test is for checking if the urine contains any bile salts. Normal urine does not contain bile salt. How do we check it? With Hayes sulfur test. Again, you do not need to know the procedure, but I can just explain it to you. You take urine and test tube and sprinkle some fine sulfur powder on top. If the sulfur powder dips down to the bottom of the test tube, this is positive test. It means the urine contains bile salt. If the sulfur is floating on top, this is negative. Urine does not contain bile salt. So what is the cause of urine containing bile salt? Obstructive jaundice. So because of obstruction, the bile does not flow to the intestine. It's absorbed from the biliary canaliculi into the bloodstream, and then it comes in the urine. The last chemical test is for ketone bodies. A normal urine does not contain any ketone bodies. What is the test for ketone bodies? Rothera's test. Don't need to know the procedure. Just remember, if you see this bright violet color or bright purple color as shown in this picture, this is a positive Rothera test. If you do not see this purple color, it is a negative Rothera test. What are the causes of ketone body in urine? Diabetic ketoacidosis, starvation, and ketogenic diet. What is ketogenic diet? The person is not eating carbohydrate, only eating fat, so the body is breaking down fat for energy. When our body breaks down fat for energy, ketone bodies are released. We finished the physical and chemical properties of urine. Now we check the microscopic examination of urine. In a microscopic examination of urine, we take urine and a test tube and we centrifuge it, and then we remove the supernatant and check the deposit and examine the deposit under the microscope. Under the microscope, we can see four different types of things. Either we can see cell or crystal or cast or parasites. In the cells under the microscope, we can see RBCs, white blood cells, epithelial cells, and spermatozoa. RBCs, this is how they appear under the microscope. They appear as small discs which are non-nucleated. Normal urine does not contain them. If we have RBCs in urine, it can be due to infection or stone or malignancy in the renal system. White blood cells under microscope in urine deposit show as discs which are larger than RBC, and they are granular. A normal urine does not have WBCs. If they are found in many WBCs are found in a urine sample, they indicate the presence of an infection in the urinary tract. Epithelial cells in urine. What is epithelial cell? Epithelial cells are the lining of the urethra, urinary bladder, and the ureter. They, under microscope, they look as large cells with a nucleus. If they are found in small number, this is normal. However, if they are found in large number, they suggest or indicate a urinary tract infection or inflammation. Spermatozoa can also be found in the urine under microscope. Feature we can see under microscope is crystals. There are many types of crystals. Just remember that the common types are calcium oxalate, uric acid, and phosphate. CUP, cup, calcium oxalate, uric acid, and phosphate. Calcium oxalate and uric acid are found in acidic urine, phosphate in alkaline urine. These threads of crystals CUP can be found in normal urine, or if they are found in larger number or bigger number, they can indicate the presence of stone in the renal system. But they can be normal or they can indicate renal stone. Crystals in urine. The first type of crystal is calcium oxalate. They look like an envelope, like the upper diagram, or they look like peanut, like the lower picture. Phosphate crystals. We have three types of phosphate crystal. Triple phosphate crystal, they are rectangular in shape. Calcium phosphate crystal, they are star shaped. And amorphous phosphate, they are whitish granules. Uric acid crystal, they vary in shape. They can be square shaped or diamond shaped or cubical or rose shaped. Urate crystal, they are needle shaped crystals, pointed at one end and broader at another end. The last type of crystal is cystine crystal. Cystine crystals are not found in normal urine. If we find cystine crystals in urine, this is pathological and they indicate a disease called cystinuria, which is an inborn error of metabolism. Another structure which can be seen under microscope is cast. Casts are tiny cylindrical or tube-like masses which are seen under microscope, and they are formed in the kidney in diseases only. Casts originate from the distal convoluted tubule or the collecting duct. Their cylindrical shape reflects the tubule in which they were formed. The cast contain either RBC, WBC, epithelial cell, or another type of cast is granular cast. This picture shows how casts are formed. So during inflammation of nephron, RBCs or WBCs, they accumulate and gather in distal convoluted tubule, and there they aggregate together and form a molded structure in the shape of the distal convoluted tubule. Then this structure after some time gets loosened, dislodged, and appears in urine in the same shape. An important point to remember about cast: if we see cast in urine, this is an indication that the patient has disease in kidney. Casts, if they are present, they indicate the disease is in kidney. A disease of urinary bladder or of ureter will not give cast. Cast, if they are present, it means there is disease of kidney. RBC cast is reddish brownish in color, and if they are present, again it indicates disease of kidney. This is how the WBC cast or pus cast looks like. The cells in the cast are granular with granular cytoplasm. If casts are present, it indicates disease of kidney. Casts of epithelial cells show bigger epithelial cells in the cast, and if a cast is present, it indicates disease of kidney. Granular cast, these are casts which were before WBC or epithelial cell cast or RBC cast, and because of long standing time, the cells, the WBCs or the epithelial cells, they broke down and became like a sand or granular structure. If these granular casts are present, it indicates chronic kidney disease. The last structure which can be seen in urine is parasites. Which parasites we can see in urine? We can see Trichomonas vaginalis in female patients, and we can see also egg of schistosoma hematobium. And this is their picture how they look under microscope.